Okay, so I'm Barb Ackerman, Commissioner, and I'm going to call this meeting to order, the Health and Human Service Commission. Welcome, everyone. The first order of business is to approve the minutes from our last meeting. Does anybody have any?
I have one comment. I read the minutes. It's better than coming to the meeting.
Like that.
But on that note, I move to approve the
I've
minutes.
got one change I want to make, which is on page 4. Jim
Okay.
Lisher's name is spelled wrong.
Oh,
Also spelled wrong at the top.
Oh, is it all
Why,
there?
but
Okay.
We did
Spelled it-
fix it. Sorry, Jim.
Common mistake.
He made it kind of-
Hardly worth.
Kind of made it for
Well-
German, right? So he's got an extra C in there that doesn't belong.
I
So
went back to the other minutes to see if I've been spelling your name wrong for like 6 months, and I wasn't. Another mystery.
I
of
think it
brain.
was just.
All
I-
incorrect. Let's blame all
Just a
incorrect.
moment.
Let's blame all incorrect. That's a good one.
All right, so
You have a motion, a second,
that they be approved as amended.
as
right?
amended.
Okay.
Right.
All in favor?
Aye.
Okay, we can move on. All right, so we'll start with our health department from our freezing health
Yeah, I'm
director
sorry,
over
I'm really
there.
cold, so I'm gonna keep my coat on today. So we're working on increasing our social media presence as a way to get information out to the community. So if you are not already, we would love it if you could follow us on Facebook and Instagram and share us with your friends. We will be posting all of our health education offerings as well as, different guidance and information as it's coming out. We're still working on filling our open position and we'll be interviewing hopefully sometime this month. We're joining with New Canaan Cares and now working closely with them with some other health education. Our public health nurse went to a TB symposium, came back with lots of information. It's a very fascinating subject that ironically falls to local health when there is a diagnosis of somebody in the community with TB.
do we have any of that?
We do not, but we would be required to respond if we did.
It is in the area though. I mean, in the
Oh, it
northeast,
is.
absolutely.
Yes.
Yeah.
How would you
Yes.
respond?
Nurse has to monitor the patients and oversee their medication and receiving the medication and all of the testing that goes along with it and clearance. And
Wow.
there's a whole thing with TB. So
So
she
it's
went to
all
that.
local.
Yeah, it's
You
all
have to
done
like watch
locally.
the patient take the meds every day.
Oh my
Typically.
gosh.
Yeah.
Yeah.
Mhm.
So it's a
It's-
big
It's
commitment.
It's a
a
big
direct
It's a big
observation.
commitment,
Yeah.
yeah.
Yeah. So I was super excited she went because that is not my area of expertise. So it's always good to have somebody refresh on that in case we do get something. And this year we are only doing flu vaccines for children by appointment only. And then
You
just
comfortable with that? Sorry. I didn't-
Yes, yes, I think it's perfect. We're gonna fill in the voids with any pediatricians where they can't get to the pediatrician or the timing for their pediatrician clinics doesn't work. And then we can be there to fill in whenever they need or whatever they need.
Great.
I included some different data this month. So the first one is the respiratory vaccination data from the last 2 years. This is for the whole town, not just what was given by the health department, but for the entire town coverage. And so I think it's always helpful to kind of see, what the percentage of population is getting and what they're not getting. So it's pretty average for the area of the state and the size of the town. So there's nothing unusual. The link below it is actually what the state provides every respiratory virus season. And it is the dashboard of all the different illnesses and ER visits. So if you are somebody who likes to watch kind of where we are in flu season and things like that, that would be the webpage that you would follow. And then I redid the suicidal ideation chart after we had
Can I
talked.
ask a quick
Oh, yeah.
question? Is there a reason to pick just those two?
Those
COVID
are the
and
two that
or is it-
are provided to us for respiratory vaccine data. Part of it could be the RSV vaccine is so new that we don't have enough.
And getting back to you guys don't necessarily.
No, they don't
follow
cover, they don't follow that one. So. That's okay. And so the suicide ideation table is, I just updated the graph to kind of reflect where we are. I think we're gonna probably see this one less frequently, if that's okay with you.
Well, I think we talked about doing it quarterly or,
Yeah.
so it's I appreciate very much that you gave us that time frame.
So, and
Do
then
you want to talk about it a little bit, the trends or
it seems pretty,
pretty?
yeah, I mean, there's nothing on there that's jumping out at me,
Mhm.
So, and
It
then.
seemed like it's in the winter more.
Which-
If that's related to anything, right?
Dark.
Yeah, I mean, it's,
Yeah.
so, it's a little bit higher in the winter, but that's holidays and stuff like that too.
Actually, just a quick question on this. Do they ever give you like repeat numbers? Like, are these same people?
They don't tell us. So it could be, there's no way to know. And they don't tell us for numbers under 6.
Mhm.
So all of those blue lines are the number of records for that month were less than 6
For New Canaan,
for New Canaan.
because 5 a month is a lot.
It could be 0.
It could be
No, I
one.
understand, but it could be a
one,
lot. or
yeah.
It could be,
Yeah, I mean, and again, this is 6 for, the entire population of
do
the,
they give us a total for the year or something like that so that so you don't want to look at 1 month and jump to conclusions, but would they give us a total, including those months with the blue lines for the,
for the year.
For the
I mean, I
year.
can look into it and see if they give
Yeah.
a year end.
Am I remembering that this data comes from ED visits?
Correct.
So we don't know what's going on that doesn't
so
involve
this is
ED,
tip of the
right?
iceberg, I suppose,
Yeah.
maybe. I don't-
Look, I know relative, Rose Park still, I know relative to other towns that this may be, low. I just think as a commission, this is something that's been on our radar. It's the reason that we started some of our programs in town and our funding that we've had for the Silver Hill program. And so we put a lot of attention to this. So that when you hear questions on it, it may not look atypical to other towns our size, but it's something that we've really
Yeah.
focused on because we're looking at programs upstream, early intervention, schoolhouse identification, education training for parents. So when you have, I just want to, as a relatively new person, that's why we are, a little bit more hyper focused on it.
Okay, and that's not something that, we get the report, but that's not truly something in our wheelhouse that we control. That's
No.
not, it's not part of our, our mandates by the state. It's not part of any of our regulations. We do some health education related to mental health, but it's not a true health department,
Do you,
Function,
is it
responsibility.
do you, in professional opinion, do you think it's an indicator of community mental health? Or is it just kind of a?
I personally don't think so.
Okay.
Just because, just as a person, I would always expect some sort of background of mental health crisis in a community, regardless of the community. There's always going to be somebody who's going through something.
Right.
And, I don't
But
think
not
that's,
related to some systemic thing, more related to personal circumstances.
Exactly.
Or medical circumstances or something.
Right.
Okay.
Tom's question is the sort of key one because this is the one we sort of have. It's a flawed metric because the reporting that happens in ED, it's based on what people are saying and stuff like that. I think we'd be really interested in, your work. What are the things that might be a little more indicative broadly? And I don't know if they exist, but we struggle with metric. This is the one we have, so it's the one we always talk about,
Right.
and it's sort of
It's
is
hard
what it
'cause I
is.
feel
it's
like
really
I know
something more from Marcy.
Raquel
Right,
is-
and I think like you kind of make assumptions, which you shouldn't do, because we don't know what brought this person in, and we don't know if there was like substance use, or if it was like,
Right.
a domestic fight and a
Mhm.
threat, and, you don't know exactly what, because they have to report that it's
Yeah.
been said, right?
Yeah, no,
But-
it's complicated. Like someone could come in completely intoxicated on whatever substance, say they're thinking of harming themselves. Once they're sober, they're like, oh, I didn't mean that, but you've still coded it that way and that information has still been logged in the system. And so, that's,
Right.
so it is extremely complicated. I do think that point that you just said, Amy, it's not really your wheelhouse. It's not really where you sit in terms of the health department. And we talk about this a lot. But, it's something we're interested in because we don't necessarily have another thing that's
Data
focused on it.
source.
Yeah.
I'm gonna do a point of order here, or whatever it's called. Just the next time you talk, just please introduce yourselves, because Russ did that, but we've been
Thank
forgetting.
you. I was,
Robert's rules, right?
It's also a natural.
Didn't mean to interrupt that conversation. though. I just wanted to-
That's fair.
It really probably is more something that's
Yeah.
appropriate for you, Marcy. Talk about it.
But as an ongoing thing, your bag of tricks, like what are the metrics that you found? Oh, over time, I really wound up focusing on this, and that.
Will you introduce yourself?
Oh, sorry.
Good listening.
Campbell.
Example.
And things that you think that we ought to be looking at which frequency and stuff like that, best practices as you understand it within the stuff that we know, because we're really open to upping our game in terms of the things that we track, and maybe we want to downgrade a little bit some of the things that we're looking at all the time. But if you have particular strong views based on your experience, I think we really would love to learn more about how we can use metrics for the greater good.
So Amy Lahaney, was thinking that each time I would come in, I was wanting to focus on a different metric for you guys to look at, but they're probably not related to mental health. So like this month's was respiratory vaccine data, because it is an interesting, and it's in the health department's wheelhouse, that we're watching what the community is doing vaccination wise, as well as protection for the community as a whole against flu and COVID. I wanted in the next 2 or 3 months, you're going to see the 2024 reportable disease numbers for the community, which I think you'll find somewhat interesting. And then so every year I would like to show you guys what our reportable diseases are, because those are things that some cases we are following up with the patients directly and talking to them. In other cases we are not, but it does give a lot of trends in the community for certain of the illnesses and diseases.
That'd be great.
So I'm hoping to bring some other data points in for you that show you a little bit more of some of the public health side, and give you a feel of all the different things that we actually do end up touching on.
Russ Park, so we've spent an awful lot of time highlighting what our priorities are, right? Our top 3. So if we can try to, I'm data driven. If we can figure out a way to focus on how to measure data, as to Peter's point, that's relatable to those priorities. I mean, we have to talk about New Canaan Community Foundation and their grants coming through and what they're going to be looking at. But and this is just one person's opinion, if you see something that is a red flag across your database, then absolutely we would want to know about it and bring it to the commission. But we also don't want to be onerous in terms of your time and your reporting. So I think it helps if we help them. Here are our 3 priorities. If there's data around that, we'd like to have it on a routine basis. But if you see a red flag go up, here's something that's atypical that you need to bring to us, then I think that's the appropriate approach. That's just my opinion.
Yeah, no, I think everybody would agree with that. Yeah,
Like
no,
that.
thank you.
Do you-
Russ. Well said.
Does public health encompass mental health and behavioral health? I'm just getting the impression maybe historically it hasn't,
It historically has not.
and that's kind of,
It historically has not. We've branched more into it, but more on an education side than any sort of treatment side, because that's not,
okay, right, but
yeah.
And if in the Russ Park, so this is the last point I'm going to make, I promise. If you feel that you're going to be limited to resources in terms of any kind of vaccination, flu vaccination, respiratory, whatever it may be, there are community partners that you can reach out, and just like I won't speak for Wilton, but I'll give Wilton as an example. Weston, they will reach out and say, we want to do a flu clinic, this week, and let's find partners. That's my end of time. That's what that is long goes.
That's to do my eye drops.
us,
I just, okay.
I forgot.
But there are other partners that can step up and say, we'll handle a flu clinic for you if it's important.
Yeah, thank you. That's very helpful. Do anybody have other questions? Did we get through everything?
Just some upcoming events for us.
Right.
We're doing another QPR in the library in October. Some things at Schoolhouse addressing some safe driving and a flu clinic for them. And then we will be participating with Marcy and her wonderful employee wellness fair as well. Also in October, we are working on, and I'm super excited for this, a health information literacy talk at the Lapham Center. In the current news climate and social media climate, there is a lot of talk about data and information in papers. So we're going to try to kind of gather that together so people can have an understanding of when they're seeing that, what they should be looking for to see, what the study was and how to interpret it and the best way to understand all of the conflicting information.
No, that's great. Can I ask you, I'm sorry, that more stuff, the lunch and learn at Schoolhouse, I thought 20 was a really significant number of attendees. Was that? meaningful in
Actually,
terms of-
it's funny, Shannon felt it was low.
Oh, really?
Yes,
Cause I think, that's,
Shannon felt it was low when she said, when she told me that number.
oh,
So,
that's
but I will go
interesting,
back
cause
to her
I
and
feel
tell
like
her.
a lot of people
Too, because I
don't,
mean, I think there are only 37.
aren't that many
living
people there, right?
something.
Yeah.
Yeah.
And also I think a lot of them, when I worked at Staying Put, we try and go in and do programs and they didn't really want us to come
You didn't
in.
bring the food.
We did bring food though, yeah, that's true. We always brought food. But so I thought that was, I guess I thought that was encouraging and I wonder, it would have been an interesting conversation to listen to and seeing in terms of, our whole idea, can we get some of these people who are isolated to get out? I'm wondering.
Yeah, Shannon and Ellen do a lot at Schoolhouse. They're very,
Yeah.
they try to stay very active and
Which
involved
is
over
great,
there.
yeah, 'cause that's a
Isn't
population.
20 half the population?
What's your name?
Tom Ferguson.
Yeah, it is. It's about, it's like
That's
40
pretty high.
people, right? Yeah, I feel like that's high.
Yeah.
But that's interesting. Maybe people aren't going too many places. I'm making a generalization, or assumption, but a lot of times I feel like, so they're there and, maybe they just were happy, happy to learn or listen. But that's great. All right. And then the only other question I had was, who's doing all the inspections?
So all the food inspections are me, for the foreseeable future. And then Shannon is helping out with septic. So she's doing a lot of the septic work right now. And then, we're doing the building permits and stuff like that together.
Together, okay. And is
So-
it taking a lot of your time? I mean, is it?
Food
owners?
inspections take a while, but it is a great way to meet the community members and the restaurants and develop the partnership. So it's great because I'm actually getting out there and seeing everyone, meeting them myself. So it's good. It is time
Time
consuming.
consuming, yeah.
Yeah.
of course.
I have a quick question.
Sure.
What's the latest count, what's the latest count on number of food inspection restaurant?
I would have
Places
to
that we're
look it
looking
up
at.
because I don't know that number off the top of my head. We are coming into relicensing season soon, so we'll have a firmer number, but it seems like a lot.
I was gonna say,
It seems like a lot. I
What do
only
we
look at the
need?
next month of who's due for inspections right now, just because there's a lot of restaurants.
There are so many, yeah.
Yes, and I finished, I had to do all the schools in September so that they could be all done, and so we're getting them done.
Well, no, that's great. We appreciate that this is an extra burden for you, though. And I hope you can find a good candidate soon.
Yes, I'm hopeful.
One final question, Commissioner Campbell. How are you thinking about the different, responding to the different federal statements and edicts, maybe with your new, social media strategy and stuff like that, at least from almost a strategy point of view, you kind of make monthly statements to translate what might be happening to, from a New Canaan point of view?
We're trying to follow the state and the regional messaging so that all the messaging that's coming out is consistent. The state actually now has a marketing team for the Department of Public Health who is doing monthly newsletters with marketing and social media tools so that messaging
Oh,
is more
that's great.
consistent. And the region, we met on Tuesday. And the region will also be doing something. So region 1 goes from Bridgeport Monroe all the way down to Greenwich. And so the region itself will be doing something as well that is somewhat consistent across the board for everybody. So that way the consistent messaging is there.
Great, thank you.
Feel like you're a little under the gun there. We a lot of questions, but thank you. You clarified a lot. And I really appreciate you bringing the extra data in. The new data. That's really meaningful. So thank you. All right, your turn, Marcy.
Okay, Marcy Rand, Director of Human Services. I will leave what I sent you guys. Everyone looked at that. The wellness fair is going to be 10/22. That is for employees. And as Amy said, the health department is going to be doing blood pressure. We have Walgreens coming in to do flu shots for all employees. So
That's great.
we will all be healthy. No excuses for calling out sick. A few of the numbers, I don't know. I'm not great with Excel, so I think I lost a couple lines, but I have had a couple referrals from Protective Services, 5 in fact, and I've been doing a lot of home visits for those. There was a death of a single parent in Canaan Parish that can't really be discussed. It's still under investigation as to what exactly happened. We don't know if it was domestic violence or suicide. But I did have some home visits with the family, and she was also a very favorite employee at Playhouse. So I've done a couple grief groups at the Playhouse with some of the employees. And my office is always open to them as well. I have a meeting next week with one of the employees, just to sort of process that loss, not why or how, but just the loss itself. So I've been sort of busy with that. Our holiday card drive, our gift cards for the kids, that has been slow. So if anyone would like to donate to the holiday card drive, we've put it on social media. I did ask Mike Dinan to put it out onto New Canaanite. I don't know if he's done that yet, but we would love to see a few more donations to.
Tom Ferguson, how much would you like?
Well, we give $100 per child. So anything that anyone's comfortable with, a $25 gift card, a $50 gift card.
How many children,
$100
how many
gift card.
children are?
We have between 75 and 100
Okay,
children under the age of
Okay.
18. So we don't give to the college age, which I serve. I don't know, I'll have to talk to Jackie about that because they are home at Christmas.
So it's the same group that we got the backpack.
Yes,
supplies for.
exactly. Yep. So we are starting that. I'm attending a symposium in Plantsville, Connecticut. I'm not even sure where that is, but that's on Monday on aging and disability. Is it? So that will be actually really interesting. I haven't been to one of those, so I'm looking forward to that. Our holiday basket requests are going to be beginning at the end of October. So I will be asking everyone to grab a basket and deliver it in, in the beginning of December. And then also I do not want to hound Shannon for her mental health first aid. What is it? Not a teacher.
The trainer, yeah, she's
Trainer,
ready to
thank
do
you.
it.
Has she started it yet?
No, because we had an RS thing come up.
Okay,
So and she's got to do that.
So as soon as she gets done doing that, we will do a mental health first aid. But until then, I did schedule one with Darianne. She's going to come over here and I will let everyone know the date. It's going to be in January, but we will do a mental health first aid training
That's good.
in January. And then I will grab Shannon. I know she's got a lot with septic and stuff. So after the new year, Shannon will be my partner in crime. And the last thing that I actually have for you guys is we put this, excuse that it was cut off, but we put this ad out every year at
right, I remember
the
that, yeah.
holidays for
Right.
the, no drinking and driving and contact Al-Anon. And I'm gonna have Enza email this to you guys. If you would look at it and just see if you're okay with it, we will get that ad out. We were a little bit late last year, so I want to make sure we're on top of that and we sponsor
Do you
that
have,
ad.
or do you have some ideas for it? I mean.
No, I thought it looked great.
Okay.
Like, to be honest, I thought it looked great, but I'll have her email everyone a copy of it. And so just put that in your head. And I did send you all the grant requests, but I know that Barb, you had a really good, we were working on.
Yeah,
that
well, we're
sheet,
going to talk
so-
about it next
Yeah,
month,
we'll work
right?
on that
Right.
next month. But just
Actually,
so you all-
John was helpful in, hi, John, Alyssa, by the way, if you want to step in at some point, and ask some questions, please do. Yeah, the idea that we had was basically just to do apples to apples. So in other words, look at every agency and have the same information about each, because some of the grants are very long and,
Right.
have a lot of information and some.
Right, and
just
some
tell you-
are one-page
We just want
requests.
support, yeah.
Right.
So it was the idea that we kind of look at each agency. So we're going to work on that.
Right.
So that when we talk about it next month, we have, good comparative information. And so far, I noticed the two that you sent, they're asking for the same amount of money as last year.
There should have been 5.
Oh, I only saw 2. Oh, maybe I didn't
That's
go all
okay.
the way down.
You may not
Okay.
have spoken.
Yeah. I
Yeah,
think
it's
Silver Hill had like.
87 pages. So.
Yeah, Silver Hill had, that's my point. Yeah. I mean,
Is
I
that what
think.
you thought?
I mean, I got through it like that.
Right before bed. Yeah, but I think, and it's nice to have that backup budget information. I know somebody like Russ would be able to go through and find some interesting
Sure.
things, but it's true. But I think the main thing is just to sort of see,
Yeah.
directly how they compare, so.
Absolutely.
The one thing I would add, Commissioner Barksdale, is some people know it, some people do not. Blackbird actually now rents the bar area on the first floor of the Playhouse. They had great relationships with this individual as well. It may not to add to your plate, but I would extend it out to
Okay.
them as well, because they work together collaboratively in the Playhouse. It is still very raw
Yep.
to them. It does not take very much for them to start breaking down and crying. And if you get them privately, they want to talk about it. So I would just let you know that,
Yeah,
this is
thank you.
my own,
Oh, right.
and,
And I think it didn't, her birthday was on the 30th.
her
and so
her birthday
very-
was coming up the next week. She does have two children and there is, a lot of support for her GoFundMe pages and things of that nature. So I just want to make sure that we may be a little bit more comprehensive. There may be,
I will put myself out there,
eight
yeah.
more people or something
No, of
that
course,
work
I
at,
will,
because they are now leasing space within the building.
Okay.
And so that relationship became
Okay.
much tighter.
I'll text Luke and see if he wants to he wants me to come in and do one more group, with everyone.
Sure.
And include that.
Yeah.
Absolutely.
Thank you.
Alyssa and John, do you have any questions on anything that we've been talking about so far? Just comments? No? Okay. Thank you. Thank you very much. That was a
Thank
great
you.
report. So quickly, just moving on to the commission priorities. There really isn't much to talk about here. A couple of people on the commission told me that they didn't get the priorities report. And so I brought copies. I just wanted to make sure that everybody get a copy at this point to look at? And okay, I just wanted to make sure because it was a great presentation, but it really helps to have the backup for it. I don't think there's really much to discuss right now about the priorities in terms of if anybody has any comments, if you may not have looked at it recently, but
Commissioner Barksdale, I think it'd be interesting to know what New Canaan Community Foundation, I know they have some work in mental health and things of that nature that they're working on.
Yeah.
Maybe have just a brief summary of what that is.
I think John's going to touch on that too,
Okay.
right? So no more.
Do we, Barb?
Yeah.
I was just gonna say on the AI priority, there's an interesting editorial in the New Canaanite today from one of the people at Live Girl. They had spent a lot of time during the summer talking to the Live Girl camp participants about the use of AI, girls and teenagers. And so if people haven't seen the piece, it's an interesting read, and it also is talking about how prevalent it is.
Right, and how there were girls who said the only person I've told this to is AI.
Yeah.
And so that's concerning. Yeah, that's a good, thank you. I know that's something that you're very passionate about, the implications of AI.
Well, and the other key piece of that too is that because the AI is all controlled by private companies, they're telling some of their most important secrets to someone who's going to be retaining the data over time. It's not like talking to a trusted parent or adult.
Right. Right, okay. Anybody have any other comments? Oh, yeah, you had a
Just
question.
a question whether the priorities are something we should vote on to formally adopt.
That's a good question. How do people feel about that? I don't think we did last time, but it probably would be a good idea. Can we do that now, or do you want to?
Commissioner Barksdale, do we want to wait until the other presentation on the geriatric community before we vote and do it as a package? There may be some overlap or there may not be. I mean,
That's an excellent.
that's just a recommendation.
excellent idea.
Yeah, I think that we were going to be deferring voting on the recommendations because I think in light of developments since the last meeting, we wanted to go back and revisit some of the draft recommendations. A couple of things. One, with Jim's retirement, some of the draft recommendations were things which he was very passionate about, and assuming that we want to continue with them, we want to be sure that we have advocates on the commission who are willing to move those forward. And then also I could touch briefly on the Community Foundation. They put out requests for grant proposals on follow-ups to the survey, and then also on systems change in Lower Fairfield County. And they've recently received those proposals and are doing an initial review. But the other thought we had was that particularly as it relates to the survey, it'd be nice to see what grant proposals are being funded because they may overlap with or replace the need for us to have as one of our priorities, something that someone else is taking on board and is being funded for.
That makes sense. Is the Behavioral Health Committee of the?
Introduce yourself.
Oh, sorry. My bad. I honestly only meant the first time. I know you've been very good about it, but Commissioner Heckenberg, I forgot my question.
Sorry.
What the foundation was to say, well, is it the Behavioral Health Committee of the Community Foundation that evaluates those RFPs? Or
Yeah,
those,
Commissioner Knight,
grants?
it's the Behavioral Health Committee, which has a separate budget to fund behavioral health grants out of cycle. So it's not part of the main grant cycle where the applications are due toward and are considered in the spring.
Okay, all right, well, does anyone want anything else about,
Peter, sorry, Commissioner Knight again. Peter, did you want to add anything in addition on that?
No,
you're on the committee too?
yeah, but I have it, I missed the last meeting. John thankfully was there, but you know, where the goals are a little different. I think the priorities for us are like overall that should encompass all the sort of different work, whereas, you know, the Behavioral Health Committee is going to do their thing at the foundation. They're sort of separate, and ours should be a little bit more general and frankly longer term. And I think, you know, we're listening carefully to what the foundation is doing, because they've got real resource, and obviously the survey was kind of amazing, but we're kind of working in partnership with them.
I think that's true, Peter. Commissioner Knight again. I think to give an example, so one of the things that we found from the senior survey was that, you know, in terms of information about where to go to a non-immediate mental health or behavioral health crisis, that there was a question about, there's lots of lists of organizations out there, but, you know, people felt uncertain about where to go. That's a similar issue for the 30 to 49. That's a similar issue for families with children. And if some of the proposals are for organizations which are currently out there doing that type of work, and they're looking to expand on the directory of information that's available and the marketing of that information to the public, it's something that we could piggyback on. It's not something that we would necessarily need to try and quarterback ourselves.
Well, that's the key, is they've got resources, people, and funding. And I think us as viewing the whole constellation and trying to channel all the different constituencies out there and what we think are the sort of major priorities, the doing is hopefully informed by what we're saying about priorities, but we just don't have the resources. I mean, you guys are doing sort of everything you do, but these extra initiatives, I think we're trying to help align all the private initiatives and the other organizations around the big issues as we see them. And there's so much creativity and talented people on that Behavioral Health Committee. I mean, I always think there are going to be great things coming out from them.
You mean the Alliance, or your committee?
Well, the Foundation Committee,
Right.
the Alliance, of course,
Yeah.
which is another great
Right, but the committee
organization.
itself.
And so I think our lane, such as it is trying to look across this whole world, channeling you guys and what we see, and frankly, helping senior town leadership understand what we think are the biggest things overall, and then everybody can track off that and do the work that they're going to do. Is such as it is how we're thinking about the different lanes.
Well, Commissioner Workstow, I mean, I agree with you, Peter, that it'd be nice to know, you know, my understanding, they have quite a few funds, and then, you know, people are coming together for that New Canaan Community Foundation segment or ad hoc committee. I think ours is more longer term, but I still think that it's important that we know, you know, if it is one of our priorities and bringing attention to it, you know, we don't want to be a one and done type of organization, right? We don't want to be, or we find the seed money and it's a huge problem, or where's funding in year 2, where's funding in year 3? And I think we talked about that a lot as a commission when we were looking at Silver Hill and getting in the early, or we have the seed money to start and develop it, but then what happens in year 2? What happens in year 3? And how do we look back to say, you know, some of these resources could be spent now that we know what our data is and where our metrics, we can now spend more funding early on in the process? Or truly, are we just going to be the safety net and provide services when they're asked for? So that's a discussion I think that is appropriate for this commission to have, because it needs to be at that longer term horizon than an immediate injection into, okay, where are these services going to be provided? Here's $100,000 to go toward. Okay, well, what happens, year 2, year 3, and how is that followed up in a cohesive, self-learning manner, that we are learning from our data and stats so that we can have a better productivity going forward.
I think that's a great point. I think our November meeting, we're going to talk specifically around the funding and frankly, the strategies around the funding, which are, there's some probably smart evolution in terms of the strategy of what we're trying to do. And that I think will be a key part of the discussion next month.
Yeah, I wouldn't be, Commissioner Barks, I want to be clear. We're not looking to add anything onto our overworked, underpaid, and immediate and overly appreciative team that you guys have in everything that you're doing. I want to make sure that you understand that. There's no reflection. You guys are doing great work, and
Tom wants to know if that can go in the minute.
and well, they're the one that told me to put them in there, but I don't want to take away. You guys are doing a lot, and need all the support from us that is worthy of everything that you do, and we should be doing that. But there are other things that are going on that we don't have to necessarily be in and driving and taking our time, but it would be nice to have that executive summary, so that we know and we can at least talk intellectually about it, and also figure out where it fits within our strategy. That's all, if that made sense.
A quick comment in that the finding of the 24 study on all adults' behavioral health and wellness specified that training and education of the population is critical, and we reached the same conclusion in the seniors thing, and reaffirmed that. The fact that there are communication conduits, the fact that we have 2 members of this commission that are also on the foundation board, the fact that the foundation board, Lauren, basically runs the alliance, and the alliance includes members of our staff. That the fact is that we have the communication systems in place to actually bring that education and training to life, and I think that's going to be absolutely critical. So
Right, and the Alliance is actually, thank you, Jim, that's a really good point. The Alliance is actually meeting next week, and I talked to Meg, and she said they put together a kind of a packet they're going to share with their ideas for next steps, and they've identified some work groups who will address some of these issues, so that probably will really dovetail with what we're talking about. Okay, so, all right, anybody have anything else to add to that? Well, then maybe we could have a motion to approve the priorities as presented. We want to do that? Tom, thank you. A second? Is that? No second?
What?
Oh, okay.
I'll second it.
Okay, thanks, Jen. Do you want to have some discussion about it? More discussion?
The Commissioner Barks, I just want to make sure what priorities are we voting on?
Oh, yeah.
Are we voting on
We're
the
voting on the priority statement that was.
priority
prepared by
statement?
the-
Got it. I
Sorry,
wanted to make
yeah.
sure, because I know
I've got,
I
yeah,
know
got a
John Knight
copy for everybody.
had asked for more time. Commissioner Knight had asked for more time, right, on the geriatric assessment, the senior
Right,
assessment.
right. This is
Okay.
not something that, we're not talking about the recommendations for that. We're just talking about
I
the
did-
proposed priorities.
I just wanna
No,
make
that's a really important point. I should have clarified that. Yeah. And that was created by the team that Peter put together. And so I think this would be a document. This is an update of what we did in 2023, 24. And the committee went back and looked at it and tried to review, how things had changed, and added these ideas for emerging issues and things that we need to look out for. So I think it's a very current document. And if we approve it now, we can go back and look at it again in a couple of years and see whether we want to make any changes based on what we know already and what's happened since that time. So is everybody in favor of approving the priorities document as presented? And opposed? Anybody opposed? Okay, so thank you for that.
Great.
The motion passes. Okay, so we're gonna have, the next thing on the agenda is the proposed 2026 commission meeting dates. So did everybody have a chance to look at those? See that we switched over to first Tuesdays at 9 a.m. There's a possibility that it will conflict with a town council meeting. They meet Tuesday and Thursday, but they don't always meet on the first Tuesday or Thursday, kind of put their schedules together later. But I talked to Pam and she said they always meet in the bigger room. And, you know, the only issue, and that's always happening, but the only issue would be if somebody on the commission wanted to go to that meeting. And so that would be kind of a conflict. But I said, I think everybody we can always watch it later if you're interested. And so I think it's
Not an
probably
issue with me.
not an issue with you. And I will say that today is Yom Kippur, and so we really probably shouldn't be meeting today because it's obviously an important holiday to a lot of people, but that's how the schedule was worked out. I checked all the holidays and we're all set. So we're not going to conflict with any of those.
I have a quick question about. the
Sure.
calendar. Marcy,
Marcy.
Director of Human Services. The last summer, we were off July and August.
Yes.
So I would like to propose July and August. They're crazy
Such a-
months and they're quiet
Okay.
months for the town. I don't know if.
Well,
you
the
guys
reason
are
I put
really
the
embedded
July
in
back is because Harrison Pierce told me that, that the only reason we didn't do July was because it was July 4th. And so that didn't make sense to meet that day. But when I was doing it, I had the same feeling. I thought it was
Yeah.
really nice for everybody to have the summer off, especially for you. And we didn't have a lot of, schools out, there aren't as
Right.
many issues going on. So I would be comfortable if we want to just eliminate the July meeting.
Amy Lahini, can I something we had done in Monroe was that we kept the meetings on the calendar because
Okay.
it's easier to keep them on and cancel them than it
Okay.
is to add one back if something was going on. I don't know if it's the same process in New Canaan.
I'm sure you're right.
But we would keep them on and then we would just cancel them if there was nothing going
Okay.
on, but
We
they
could
would
do
be
that,
there
yeah.
as a
All right.
So in
placeholder
May or something.
in
we
case
can decide.
something is happening.
I think that's an excellent way to do it. So then I guess we would just want to approve the calendar as prepared. And I know Wednesday, was Wednesday a better day for you? I can't remember when we talked about this. Is Tuesday's an okay day for you?
Tuesday's okay, yeah, unless
Okay,
we have to go in
right.
front of the Board of Selectmen or something.
Right.
And then we just get here. a little bit.
Yeah, you could just leave or come late. Okay.
I make a motion to approve the calendar as was presented in the email.
Okay.
Okay, all in favor? Do you want a copy? Did you want a hard copy?
No, I got a copy.
All right, well, this is kind of a rare
The close.
situation where we're done with our formal meeting at 9:30, so we can adjourn.
Barb,
I know my
we
role.
can make
I
up
know my
issues.
role in the
Oh, yeah,
organization.
We could talk about, which we can do in another meeting.
John had his hand up and I know
Oh, yeah.
Commissioner.
Thank you for seeing
sorry,
that.
Commissioner, I was just going to ask, do we have a representative that attends the Alliance meeting?
I do.
Oh, okay, perfect.
It's
Thank you.
Marcy. Yeah, I sit with Marcy. and she tells
Great,
me
thank you.
Did they produce a minutes or any sort of
They,
report?
they don't, but I know they're gonna, I asked that Meg, can you tell me what's going on? She said, we're gonna release it on Tuesday. So, I mean, the Alliance has probably 60 members. It's a very big
Cool.
group. And so it will be, I will send it out, whatever she presents, because I'm sure it's public information because it's going to so many people. But it's exciting because they really are taking that date. It's taken a little time, but they've worked really hard to try and figure out what next steps can be. And to the points that many of you made, a lot of it may be similar to what we think is important too. And so we can just put our little share, maybe serve on one of those, send somebody representative to one of the committees and make sure that the needs that we've identified are being addressed and heard anyway. Okay,
Commissioner Barksdale, just one question. Do we have an idea of the agenda for next month? Is the agenda for next month going to be on the grant proposal? I just want to,
yes.
be attuned to as
Yeah,
emails come through.
Peter, I'm going to be out of town, so Peter is going to be your leader. Do you want to talk about your agenda?
I haven't really thought about it, but I think it's the budget and grant proposals, and the only thing we might want to augment is there's a shift in kind of how we've sort of done it historically and go through it, in concentrating the spend in a few, fewer, bigger bets, but just to openly sort of talk about all of that. I think we're generally, supportive. It'd be good to hear that, and Marcy, kind of your vision of that. And stretch out a little bit.
Yeah, I just
Give
want to
some
make
time
sure, Commissioner Marcel, that, we have the budget ahead of time, that we don't have kind of a moving target. We know what our fiscal lane is in terms of what's available, and to support, the departments that report to us. So I just wanted to, kind of give a highlight.
And just to put one issue out there, I'd love to think about, because one of the things that's happening in the budget is we've got these outside sources that are supplanting a lot, like the opioid money. And sometimes when budgeting happens, you get locked in to like a baseline number. Right now, we've got this shorter term money that is dealing with a lot of needs. And I just want us to be very intentional about that if this is the overall number we need, and that there might be a moment in the future where the
Right, we're gonna have
opioid
to
money runs out.
ask
I
for
don't want us to get locked in
Right.
to a temporary situation. So just, let's talk about that as a group, as a,
Well, there's a spreadsheet that has the last few years and the
Right.
budget and the actual and all, and the next, well, that's, and outside sources.
Right.
Is that going to be available when we have the discussion?
I will ask, yeah, Anne, Kelly Lenz said that she would get all of that
If she's
to me.
from
I can
finance
ask
area?
Ryan
Okay,
from finance to.
that'd be good.
Yeah.
So you probably know your
Is
budget.
that,
Right.
when do we have to make our recommendations on grants?
I think that we should try to get that sort of narrowed down in November.
November?
Yeah.
Okay, good.
The
The budget-
budget meetings start January, February, and March.
We should all attend Marcy's meeting.
You do
presentation,
not
because
have to,
she
please.
described a great presentation, and you did make
No
it very
pressure,
clear. We
please.
really used what you wrote to make clear the different sources of funding, and,
Yeah.
you made it very clear. But, so you'll know your budget by then.
Yes.
That's good. And I think, I don't know if everybody knows, but Kids in Crisis Counselor is no longer part of our budget. The high school, or Brian Lutzy, the superintendent, has had conversations with a lot of people, and he elected to bring that role in-house. So there's a new counselor that is part of the high school, but Kids in Crisis is not directly involved. So that's actually, it was $88,000. So it was a really big part of our budget. So our budget now is a little more even across all the different agencies. And I don't know if we want to add anything to that about.
You know what? I don't right now because I don't know what our budget.
Right, but in terms of the
is
Kids in
going to be.
Crisis.
Yeah, no, in terms of the Kids in Crisis, the budget that we had for them is going to the high school. Like the money that we allotted for Kids in Crisis
Mhm.
is going to go to the high school this year. And then next year it will not. So I don't know.
Right.
If that money is then no longer ours, to do with
Yeah.
our budget.
It's likely.
get
that that's
smaller
true,
or-
but, yeah, but we'll find out.
So we'll find out.
Does anybody have any questions about that, or?
Well, I just think now that we have a formal document, that any grant that comes through should be, screened, if you will, based upon the priorities that we have set for the commission. And however we want to share that with people that are requesting funds for us, so they know that these are our priorities, I think could be
Really good
helpful for them as well when they're putting their documents together, that,
It's an excellent point, right? How they align with our priorities.
Exactly.
How they fit
Strategic,
into it, part of it that.
yeah, one thing that we're finding useful is having I've had a couple of one-off conversations with sort of town leaders as to sort of walking through the priorities and definitely stating what it is and what it is not. I mean, this is the summation of all the work that we're doing about, from the data and everything else, the things that are probably most important and the emerging trends. And we're not making statements about budget. That's not what this is about. And I think they found it useful just to keep their minds on, because they're more generalists, like keep your eye on these issues. And it's proving to be a little bit helpful to do with what they will. And I think we've been struggling with roll a lot, but this has been a helpful kind of thing to say, hey, keeping this in the back of your minds. Then, as they're going through budget and everything else, something might pop up and go, oh yeah, I remember that. I got to pay attention to this. And I think that's our commission actually filling a gap.
Right.
And adding some value. But we clearly stay away from the in this document, at least, the budget issues, which is where I think we should have that full discussion about kind of the guidance that we're getting from the, the Board of Selectmen and all of that about, because that's, again, not our lane, other than if we think something is really being given short shrift that we think is really important. Because that is where we do need to raise our hand and go. Like, even the one thing in the priorities issue that Russ often brings up is with the shifting demographics, the caseload going up, is the budget for your area is adequate? Because there'll be a point in time where it won't be.
Right.
And we got to make sure that there will be we would advocate for a step function change in funding to meet the drip, drip, drip of, issues coming up. But that's where we would, I think, really assert, ourselves. And anyway, that's sort of.
No, that's true. And I think the town leadership was very open to that and appreciative that we were sharing what we're trying to do in terms of priorities. So, and that if something were to happen that we thought was really needed to be addressed, now they understand where we're coming from if we go. So, okay. All right, we were trying to leave early.
I'm sorry, Peter,
I know.
it was worth the wait, Peter. So, Commissioner Barksdale, commission to adjourn.
Oh my gosh.
Commission to adjourn. Motion to adjourn.
Commission to adjourn. All in favor?
Aye.
Okay, thank you all very
Thank
much.
you.
You guys.
Good meeting.